Hello, my name is Dr. Dewan S. Raja. Today I will discuss about neonatal respiratory distress syndrome, also known as hyaline membrane disease, also called NRDS. Neonatal respiratory distress syndrome, also called hyaline membrane disease, is a serious condition that affects newborn, primarily preterm infants. Deficiency of surfactant produced by type 2 pneumocyte or type 2 alveolar cells produces NRDS or neonatal respiratory distress syndrome. The lungs are underinflated and the alveoli contains a fluid with high protein content that resembles a glassy or hyaline membrane. So it is also called hyaline membrane disease. This membrane is thought to be derived from a combination of substances in the circulation and from the injured pulmonary epithelium. We can say the alveolar epithelium. So we'll get this membrane. What are the causes of neonatal respiratory distress syndrome, hyaline membrane disease? The primary cause of NRDS is surfactant deficiency, which is produced by the pneumocyte type 2 cell or alveolar type 2 cell, which results in alveolar collapse. Without enough surfactant, alveoli cannot remain open during exhalation. Impaired gas exchange, reduced oxygen intake, and increased carbon dioxide retention. Okay. Surfactant gradually increases until 33 to 36 weeks of gestation. After 36 weeks, there is a surge in surfactant. So, in preterm babies, I mean fetuses, if those babies born prematurely, their surfactant are not sufficient. Okay. Type 2 pneumocyte produces surfactant, also called type 2 alveolar cell. This is the normal alveoli lined by simple squamous epithelium, type 1 pneumocyte, and type 2 pneumocyte are a little bit cuboidal, and those type 2 cell produces surfactant in their cytoplasm. This is the normal alveoli. This is the collapsed alveoli due to hyaline membrane disease. So lungs alveoli are collapsed here in comparison to that. An X-ray feature will get the membrane due to degenerative epithelial cell, the pneumocyte type 1 cell that will give the hyaline membrane appearance like this. So this hyaline membrane is composed of degenerated pneumocyte cell lining of the alveoli plus other inflammatory cells and protein. Respiratory symptom following premature delivery, decreased respiration, diminishes oxygen to brain, resulting in tissue death. Okay. So oxygen to the brain is also decreased and there will be tissue death. We got that here. Respiratory distress syndrome following premature delivery. Thickened and inflamed alveoli reduces oxygen and carbon dioxide exchange. So we'll get hyaline membrane here. This is the artery. This part is the alveoli and will get thickened hyaline membrane. So this is the respiratory distress syndrome. And this image has been taken from Google, NHLBI, National Heart, Lung and Blood Institute. Risk factor, prematurity, the most significant risk factor. Surfactant production increases significantly after 32 to 34 weeks of gestation and peak around 37 weeks. There is some historical figure like the son of President John F. Kennedy in 1963 born prematurely around 33-34 weeks, and the baby died within 2 days. In those days, there was no good treatment for neonatal respiratory distress syndrome. Okay. Maternal diabetes can delay fetal lung maturation. Perinatal asphyxia, insufficient oxygen to the fetus before or during delivery. This happen in obstructed delivery or maybe due to umbilical cord entanglement around the neck. Okay, so that may lead to perinatal asphyxia. Caesarean delivery without labor, lack of stress hormone, which aids surfactant production. Stress hormone like aldosterone, epinephrine. Okay, multiple gestation, twin, triplet. Babies are small, fetuses are small lung, and immature lung, so that will have less surfactant. Symptoms of neonatal respiratory distress syndrome or hyaline membrane disease. Symptoms of NRDS usually appear shortly after birth and include rapid, shallow breathing, trachypnea. Rate of breathing is high, but it is not in depth. Okay, not useful. Grunting during exhalation, flaring of the nostrils, cyanosis, blue skin due to deoxygenated hemoglobin, retraction, pulling of the chest with each breath. Okay. Neonatal respiratory distress syndrome, hyaline membrane disease diagnosis, certainly the history, clinical signs, symptoms of prematurity, chest x-ray shows a characteristic ground glass appearance like this. Ground glass, it should be darker, but it is not in this case of neonatal respiratory distress syndrome. It is ground glass appearance. Okay. And also we'll get air bronchogram, 1, 2, 3, air bronchogram. Blood gas analysis reveals low oxygen level and increased carbon dioxide. So, neonatal respiratory distress syndrome or hyaline membrane disease, what is the treatment? Our newborn are lacking surfactant, so we'll replace surfactant. Administered via an endotracheal tube to improve lung function, respiratory support, continuous positive airway pressure to keep alveoli open, mechanical ventilation in severe cases, oxygen therapy ensures adequate oxygenation, supportive care, maintaining body temperature and nutrition. Prevention of hyaline membrane disease or neonatal respiratory distress syndrome. Antenatal corticosteroids administered to the mother at the risk of premature delivery. There is 24 to 34 weeks of gestation. To accelerate fetal lung maturation, the steroid will accelerate fetal lung maturation. Delayed elective caesarean delivery to allow for fetal lung maturity. Complication if untreated, chronic lung disease, bronchopulmonary dysplasia, there is a possibility. Pneumothorax, air leakage into the chest. We can call air inside the pleural space between the parietal pleura, visceral pleura. Okay, pneumothorax. Pulmonary hemorrhage, hypoxia-related brain injury. With advancement in neonatal care, outcome have significantly improved, especially with the use of surfactant therapy and respiratory support. And that's all about neonatal respiratory distress syndrome or hyaline membrane disease. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.